Home Care Matters is a weekly focus on health tips, programs, services, and the ever-changing rules and laws administering health care, and is brought to you as a public service by the Lake Sunapee Region VNA and Hospice. Now, Home Care Matters.
Lake Sunapee Region VNA and Hospice strives to continually educate the community about hospice care and is especially mindful of this in November, which is National Home Care and Hospice Month. As I have said many times in many ways, hospice is about how you live, not how long you live. It's about the quality of your life, whether that is days, weeks, months, or more. The core of the hospice philosophy is to help individuals facing life-limiting conditions to find joy and meaning in every day. Hospice could be described as addition by subtraction. Can I add to the quality of my life by taking something away? For example, if curative measures are no longer effective, do I continue to opt for treatments which might extend my life by a few weeks or months? Or do I focus on other choices for the time I have left? Do I take that trip to the Grand Canyon I've always dreamed of, or choose to stay close to home for treatments? What matters most? This is exactly what the hospice team helps patients to see and to choose. It is not unusual for patients to rally when they first come onto hospice. This may be because they have an element of control about the options in front of them. While addition by subtraction is a worthy way of looking at hospice, it is important to reiterate that choosing hospice care does not mean giving up. Even though there may no longer be a cure, that doesn't mean there isn't treatment available for pain and symptom control. This is especially true for the chronic disease population, which brings up another important point. Hospice isn't just for people with cancer. We can also help individuals with a wide variety of conditions, from COPD to Alzheimer's. Often, the interventions and treatment provided for control of symptoms are exactly what is needed to be as active and comfortable as possible, and to stay out of the hospital. Hospice is truly holistic care, with an entire team engaged to address and respect the patient's needs and wishes. It's no wonder people often feel better. So, I remind you of 10 important things to understand about hospice care. 1. Hospice is for individuals of any age, newborns to elderly. 2. Hospice does not mean giving up all medical treatment. 3. Hospice is affordable for most people through Medicare and other insurance. 4. Hospice is not only for the last few days of life. 5. Hospice supports the patient and his or her entire family. 6. Hospice is provided in your home, whether that is a private residence, nursing home, hospital, or other facility. 7. Hospice does not require you change doctors. 8. Hospice team members are on call 24 hours a day, 7 days a week. 9. Hospice is a program of the Lake Sunapee Region VNA and Hospice. It is not a separate organization. 10. Finally, hospice focuses on how you live. I'm Scott Fabry, and let me remind you that at the Lake Sunapee Region VNA and Hospice, home care matters. See you next week.